Welcome back. Mama Dr. Jones, OBGYN and mom to 4. I am here today to tell you 5 things that your OBGYN doctor wants you to know about the postpartum period. We are going to talk about sweating and peeing, baby blues, your milk coming in, that crazy bleeding, and a few warning signs that you should definitely call your doctor about. Postpartum care in the United States is not where we want it. And I hope that by sharing some of this, maybe even one person will see it and have some kind of sign or symptom that they decide they need to call their doctor about, and it helps them get better care. If you like this video, please hit that like button. I don't really know what will happen if you don't. Oh, pimple. YouTube will probably explode and stop existing. All of us would like YouTube to stay here, so go ahead and hit that like button so you don't ruin it for everybody. Number 1, sweating and peeing. In the postpartum period, your body is getting rid of a lot of fluid. You hold on to extra fluid when you're pregnant, you hold on to extra fluid during labor. A lot of times you're given extra fluids through an IV during labor, and if you ended up having a C-section or you had a planned C-section, you're often given a lot of extra fluids during that as well. After you have the baby and you move over to the postpartum side, then your body starts trying to get rid of some of that fluid. It doesn't always happen while you're in the hospital, and you might notice when you go home, night sweats, waking up drenched in sweat, getting up and peeing as much as you were in the 3rd trimester, which is like every 13 minutes, and you just feel like there is fluid leaving your body everywhere. You need to make sure you don't have a fever. As long as you don't have a fever when you're feeling those night sweats, it is normal. It is your body what we call diuresing, getting rid of fluid. Diuresing is actually getting rid of fluid in the pee or peeing a lot, but it's also your body getting rid of fluid by sweating. As long as you don't have a fever and you don't feel bad otherwise, it's probably your body getting rid of fluid. Number 2, baby blues or postpartum depression. The difference between these two entities is sometimes a little bit hard to tease out, but the biggest factor is in baby blues, this will not persist past about week 2 after your baby is born. And it should just feel a little bit like an irrational need to be emotional. Like when my twins were born, I distinctly remember sitting on the bathroom floor, no, I was on the tub, sitting on the side of the tub, and my husband came in and I was holding one of the babies who weighed like 4.5 pounds at that point, and I was bawling, and he's like, "What's wrong?" And I'm like, "They're just getting so big. They're growing up so fast." And I knew in my head, this is irrational. This baby weighs 4.5 pounds. It is not growing up so fast. But I couldn't help myself. It was extremely sad, and it was Christmas time, and Silent Night was playing in the other room, and there were twinkly lights, and it was just so damn sad. I could not help myself. So I knew I'm not being totally rational, but I wasn't also feeling just generally unhappy and sad. There is a difference between depression and baby blues. If you have any symptoms that are going on longer than 2 weeks, or if your symptoms don't feel like just a little bit of randomly timed emotional outbursts, then you probably should talk to your doctor a little bit more. Let them know what's going on. Certainly, if you feel like you don't have an appetite, you don't want to eat, you're not bonding well with baby, you just feel sad and don't want to get out of bed, or you just feel really anxious about things that probably wouldn't cause a lot of anxiety for you in any other time of your life, those are times that you need to let your doctor know. Additionally, if at any point you're worried about it, or you feel like your symptoms are more than just a little bit of emotional adjustment to postpartum hormones and being a new mom, just call your doctor and talk to them about it. Your OBGYN is definitely equipped to help you with postpartum depression, and they definitely want to know if something's going on that you're worried about. Most of the time, people who have baby blues have the insight to know this is just a little sadness and it doesn't go on, and I don't feel overwhelmed. I can still enjoy my day-to-day life. I'm not overwhelmed with guilt, things like that. Postpartum depression often feels a little bit more crippling. The symptoms are a little bit more intense, and they don't just go away a couple of weeks after delivery. And they can pop up weeks to months after the baby's born. So keep an eye out. If you're feeling bad or you feel like you're not adjusting well, just talk to your doctor. We want to help you. It breaks my heart when I have a patient who felt like they didn't have anywhere to go, and I always want to know if something's going on. Additionally, if at any point you ever feel like you're a danger to yourself or to the baby, that's a reason to go to the ER. If you feel like you have thoughts of hurting yourself, hurting the baby, hurting anyone else, just go to the emergency room. That is not worth it. And I know all of you listening to this think that will never happen to me, but postpartum depression is not picky. It is random a little bit. There's some risk factors, but it can happen to anyone. And if it happens to you, just know it's okay to ask for help. Number 3, your milk coming in is gonna be weird. If it's the first time you've had a baby and the first time you've experienced lactation, it is going to be unusual. In the hospital, you're generally just having a little bit of colostrum production and you don't feel like you have a lot of milk or anything. And that's okay. Baby's belly, stomach at that point is about this big and it doesn't need a lot of volume. But as a baby gets a little bigger and after you've spent a little bit of time with baby, your milk will come in. Oftentimes, women wake up in the middle of the night or be randomly happening during the middle of the day and just feel generally bad, maybe like a tingly feeling or kind of like they feel like they might be getting sick. And that sometimes is a sign that your milk is coming in. You'll notice that your breasts feel full and heavy, and then all of a sudden, breastfeeding will be different. It won't just be getting the baby latched on and it doesn't feel like anything. You now get the baby latched on. Sometimes the baby pops off because your milk is flowing and chokes them or surprises them. And sometimes you feel like a tingly feeling, which is let down when you start to nurse the baby. So your milk coming in can feel really unusual, like a flu or cold is starting. If that happens, it could be your milk coming in. That's usually at day 3 to 5 after the baby's born, but the symptoms should last a very short time. On for more than a couple of hours. Don't blame that on your milk coming in. Let your doctor know. Number 4, what is this bleeding? So bleeding in the postpartum period can be very erratic and unusual. For up to 6 or 8 weeks, it's normal to have really weird bleeding. That may mean that immediately after delivery, you have crazy heavy bleeding, or it may mean that it's not much at all. You may go home and you may have light bleeding like a period for a few days, and then it might completely go away for 2 days and come back really heavy again, and then you might spot for a week, and then it's like a period again, and then it's really heavy, and then it's nothing, and you think it's gone, and surprise, it's back again. It can be very weird. The basic idea is that any pattern is normal, meaning it might come and go, might be heavy one day and nothing for a little while, and then come back. That's okay, as long as it's not heavier than a period for a long period of time. Blood clots themselves are not concerning because sometimes when you're sitting, the way that the vagina is oriented will allow the blood to just collect there, and then when you stand up, a big blood clot will fall out. As long as you're not having heavy bleeding and a bunch of big blood clots, just a blood clot after you get up out of bed and then normal or light bleeding the rest of the day, that's probably okay too. But if you're having really heavy bleeding, that's definitely not normal. Any pattern, some days heavy, some days nothing, coming back, going away, all of that, that is definitely a very common thing in the postpartum period. Another really common weird bleeding thing is that people will feel like their bleeding has pretty much gotten better, and then right at 2 weeks after delivery, you'll notice another heavy, bright red bleeding episode. And that is generally what we call placental site involution, which is where the site of the placenta, where it was inside the uterus, is starting to heal over, and you just have another episode of heavy bleeding, and that goes away relatively quickly. Any pattern is okay, as long as it's not really heavy, and if it's really heavy, that's a reason to let your doctor know. Number 5, a few warning signs. Things that I always want my patients to call me about or come into the clinic or the hospital about. Bleeding that is heavier than a heavy period and goes on for more than a couple of hours. You need to let me know about that. A headache. If you have a severe headache that's not getting better with some Tylenol or Motrin, that's a reason to call your doctor and let them know, or go into the clinic and see. If you're having weird vision changes, you're seeing tunnel vision, you have severe pain in your belly, any unusual sudden pain or vision changes, your doctor needs to know about, because those things can represent postpartum preeclampsia, and they are definitely something we'd want to check out. Your blood pressure is high. Most of you wouldn't know this because most of you aren't checking your blood pressure at home, but if you go to the doctor or you go somewhere and check your blood pressure and it's high, meaning over 140 on the top or over 90 on the bottom, you should just give your doctor a call. A fever. If you have a temperature over 100.3 in the postpartum period, you need to call your doctor. I lost count, so we're just going to list. If you are very depressed, or you're having trouble bonding with your baby, or you feel like you have thoughts of hurting yourself or anyone else, that's a reason to immediately call your doctor. If you have bad nausea, vomiting, you can't keep anything down, or you feel like you're getting dehydrated, definitely a reason to call your doctor. If your pain is getting worse instead of better, absolutely something I would want you to call about. You're having a problem with your incision. It looks funny, it feels funny, it smells funny, it's draining something funny, always a reason to call or come in. If you have chest pain, shortness of breath, pain in your legs, or suddenly one of your legs is swollen and red, absolutely a reason to call an ambulance or go to the emergency room. Basically, anything that is out of the ordinary from a standpoint of my pain is bad, I can't breathe, I have a fever, my bleeding is really heavy. Those are all warning signs that we want to know about. If the thought goes through your head, I don't know if this is okay, call your doctor. Call labor and delivery, call triage, call your doctor, call the clinic, call the nurse line, call somebody who can tell you whether or not it's something that needs to be checked out or it's okay to watch at home. If you're worried about it, just call, because I would so rather you find out that it's okay, it's not a big deal, you can watch it at home, than it really be something and you not call and not know that you should come in. And if it seems severe or really concerning, don't be afraid to call an ambulance. If you're having trouble breathing, or your bleeding is so heavy that you may become anemic, you have sudden pain in your head that is the worst headache of your life, it's always okay to ask for help. If you like this video and you want to subscribe, we would love to have you. Everybody gets to go on vacation with me to Aruba at the end of the year.
For legal reasons, that's a joke. For legal reasons, that's a joke.
You're having to pay for it and I probably won't be there, but you'll get to go. Be kind to yourself, to each other, to me. In the comments, be kind, and I will see you next time.